a lot of the things that should have happened didn't happen. And the policy was being led by people that didn't have public health or pandemic control experience. So we didn't set up an appropriate contact tracing. We didn't follow what, for example, South Korea or Taiwan or China had done very quickly in February. So they set, for example, in Wuhan, they moved in within 2 weeks, 9,000 contact tracers, okay, for 11 million population. For the UK, we would have needed 50,000. For England and Wales, about 40,000. In fact, we could have done that. You know, when they called for volunteers, they had 750,000 people volunteered. They weren't used. At least 40,000, I would think, would have been retired nurses, doctors, people with ability to move into vulnerable communities and understand how to reach out to people. We didn't approach with suppression. And what's interesting is that this went on into March, even though on the 27th of February, the SAGE meeting reviewed their reasonable worst case scenario, and they said 80% of the UK population may become infected with a 1% fatality rate. That's on the 27th of March. That's 5 days before the Prime Minister had turned up to even one COBRA meeting. I mean, he'd missed 5. So the experts were saying this was the scale of the problem, yet they hadn't launched any test or trace serious scheme. I mean, I think we had at peak 270 contact tracers under Public Health England. And then on the March the 13th, having known about all of this, and it becoming clear that actually a public health approach was suppressing the epidemics in both China, South Korea, Hong Kong, Taiwan, etc., they got a bit worried, and SAGE said, well, they were unanimous that measures seeking to completely suppress the spread of COVID-19 will inevitably cause a second peak. And they said it's a near certainty that countries such as China, where heavy suppression is underway, will experience a second peak once measures are relaxed. That hasn't happened. I mean, China has a death rate of 3 per million. Ours is nearly 1,900 per million. So, and actually South Korea, who also just focused on mobilization of community health workers, mobile testing, and locking down people, has currently, I think, a death rate of around 33 per million. So suppression has worked in all the countries that have tried it or attempted it. We never did that.